depression among the elderly treatable? Yes, it is. Depression among the elderly can be treated through a variety of methods. And the first one is talk therapy. With talk therapy, you can go to a therapist or a psychiatrist. And this is basically done to encourage the elderly person to recognize their inaccurate patterns of thinking and thought processes that may not be suitable for the particular situation that they are going through. So with talk therapy, the elderly person goes to see a therapist and talks about their issues, and it's normally structured so that you're able to see your triggers, you're able to understand what is affecting you and how you can reverse your inaccurate thought patterns into more positive patterns and into a way that you can deal with your problems in a better way. Another method is electroconvulsive therapy, commonly referred to as ECT. This is a brain stimulation therapy in cases where depression is severe. With this therapy, it just stimulates your brain and to basically, get you to a better place because of the chemical imbalance. However, the side effect of this therapy could be confusion and memory loss, which is temporary. So it's still a suitable therapy because it has been done for over 80 years. There are also complementary therapies like yoga, exercise, walking, ballet, dancing. However, if you do these complementary therapies, you need to inform your health professional or your doctor that you're doing them. Lastly, we have medication. And medication is through the administration of antidepressants. With the administration of antidepressants, the effects can be felt as soon as 1 to 2 weeks after the medication is taken. However, it's advisable not to stop the medication without the guidance of your doctor. The reason for this is because when you stop the medication suddenly, you experience withdrawal symptoms. So with withdrawals, you need to be very careful with how you take your medication. You need to be very mindful. If you experience any symptoms that are worsening your depression, it is important to communicate with your health professional. And also, if you notice that the medication is completely not suitable for you, maybe you're having like suicidal thoughts, then it's important to let the doctor know so that they can either reduce the dosage or completely change the medication. And with antidepressants, as you get better, you go through a process where you're weaned off the medicine. So you don't just get off the medications like that. The dosage ends up getting reduced by your health professional until such a time you don't even notice when you're no longer taking your medications. So with medication, even when you go to your doctor to have medication administered, you must also tell your doctor if there are other medications that you're taking. Like a case scenario is an elderly person has blood pressure and diabetes. In this case, you may be taking something like, you may be injecting insulin, or you may be having the type of diabetes where you take tablets. So you need to list all your medications to your doctor so that they can know what medication would best interact with the medications that you are taking for your illness or your condition. Another thing is to always get your medications from the same pharmacist, because pharmacists are great resources on interactions of medications. Sometimes a pharmacist may know which medication interacts better with which one and the ones that fight each other. Because sometimes pharmacists know about medications that, your doctor may not know that a certain medication when mixed with another may fight each other in your system. So it's always good to list your medications, tell your doctor of what you're taking and the dosage so that they can be able to administer the right thing and so that this treatment can go well. Lastly, on medication, it is important that if you're taking several doses of medications, like let's say you have medications that you take like thrice a day, maybe twice a day, or every few hours, it is advisable to have a pill box. And once you tell your doctor that you have medications that you take many times a day, the doctor may prescribe something that you may take as 1 dose daily. I would advise that you do not just go off your medications, just adhere as you're meant to and follow the instructions of your health professional.